This is Haiti Merritt with Insulin Nation. We're here today at the Joslin Innovation Summit in Arlington, Virginia. I'm here with Dan Hickey from Alliance Health. Hi, Dan.
How are you?
Thanks for joining us on 5 Spot.
Oh, my pleasure.
All right. Well, the first question is, what is your greatest aspiration in combining healthcare and technology?
Well, Haiti, at Alliance Health Networks, our greatest aspiration is really to create one of the largest and most valuable social platforms for patients with chronic conditions, and really to show measurable results in improving outcomes for those patients. On the technology side, we really see technology at the center of our efforts in really connecting patients with other patients who can help them, the information that is most useful in the community, and really using that technology as the centerpiece of what we do.
Oh, that's great. Now, the catchphrase for this event is be considered part of the solution.
Yes.
What does that mean to you?
Yeah, it seems like a simple statement.
I know. Yeah.
You know, when I thought about that, it's. I think we're in an ecosystem, a healthcare ecosystem, where it's not like. I think there's companies out there like Google and Facebook that have been so disruptive and so big in the way they've kind of approached an entire industry and changed an entire industry. I don't think, with the diversity and complexity of the healthcare system, and the amount of players in the healthcare system, that there's going to be one big player that does it all. And to some extent, it's telling me that this is more a team sport than it is like an individual sport.
Right, and that leads into the next question.
Yes, exactly.
Right. Consider, we're collaborating here.
Yes, we are.
Right.
Yes. Yeah, and I think I think that's really important to for all the players to really collaborate. I think the pieces in the health ecosystem, the interdependencies are great, so that you simply can't approach it in a kind of siloed fashion,
right.
Because solving one piece of it may need 3 or 4 other pieces of it to be solved. So,
right.
I mean, again, it's just so complex and diverse in the healthcare ecosystem that collaboration is just going to be absolutely critical. Because even if you solve something as a company on your own, you're still going to probably need 3 or 4 other pieces before you can really show success.
You have to really share the information that your results anyway. So it's sort of like the information's out there. You might as well, use all your resources and join forces.
Yeah, and we all have the same goal in mind. I mean, we all are, in terms of patient outcomes and overall wellness, we're all shooting for the same thing. And I think that, and that makes it a lot easier to collaborate when you think about that. I think we just all have to acknowledge that we're in a team sport here.
Right.
This isn't golf.
Right.
So.
Isn't that interesting? It's like kumbaya.
Yeah, kumbaya.
All right. I'm going to ask you to put these cards in the order of importance for you.
Sure.
We have patient-provider relationship and interaction.
Yes.
Technology in patient healthcare. Mm-hmm. And community-based healthcare solutions.
Okay. Well, this may be surprising since we do consider ourselves at Alliance Health Networks a technology company.
Right, of course.
But I'm going to start with community-based healthcare solutions as number one.
Okay.
Again, we at Alliance Health really see the power of kind of peer-to-peer support, and the technology really is an enablement of the community-based healthcare solutions that we provide, and certainly our ability to influence outcomes. Then I'm going to put patient-provider relationship and interaction next. I mean, there's a lot being said out there in terms of, the gaps that exist there, but to some extent, I think there's been a lot of progress made from the patient-provider relationship, and at least over the last 10 years. And then finally, again, I think technology is really, really important, but it's more of an enablement as a platform than anything else, so I'm going to put that third.
Great. Okay, well, thank you.